This is Chadi Alraies, CVI 2019, Denver, Colorado. With me is Eugen Ivan. He's from Comanche Medical Center. He presented a very interesting and poster at the meeting in 2019. Welcome, Ivan.
Hey, Chadi. Yeah. Thank you very much for having me on here.
Thank you.
It's a pleasure.
Thank you. Dr. Ivan, so tell us about your poster. It's a very interesting topic and I think very timely.
Yes, thank you, Chadi. So we studied our patient population, which includes a very large contingent of vulnerable patient subpopulations, and specifically Native Americans. And as has been shown before, they suffer disproportionately from peripheral vascular disease. And they have an extremely high, among all population that are studied, an extremely high incidence of lower limb amputations and severe peripheral vascular disease. So we wanted to see how we can help this vulnerable patient subpopulation.
So are they presenting late because they already had an amputation, or your intervention or procedure was to catch them before they head that way?
Yes, so our intervention was for limb salvage.
Yeah.
So these are patients who are presenting with CLI, critical limb ischemia, meaning either ischemic rest pain or they have already
ulcers,
some tissue loss, necrosis, gangrene, etc., or very commonly non-healing wounds, which have been present for at least 4 weeks or longer.
Was this a single center database, or it was a registry of multiple centers?
This was a database of a single center, but multiple operators. It was me and 3 other colleagues.
Nice. So walk us through the method and results.
Yes. So we looked at our data for the last 4.5 years between 2014 and 2019. We concluded data collection in February of this year, and we were able to collect a total of 74 patients that presented, both Native Americans and non-Native Americans. And out of the whole contingent with calcific peripheral vascular disease, very severe peripheral vascular disease, where we had to employ a modality called orbital atherectomy in order to modify the compliance of the vessels and be able to treat these patients properly. We identified 16.3%, which were of Native American ancestry. We have a large population of Native Americans, and we categorized those and then studied the relative outcomes of Native Americans versus non-Native American patients who undergo orbital atherectomy for limb salvage and prevention of amputation.
Right. So how was in this percentage, how many patients were in the Native American arm, how many patients were in non-Native?
So there were 26 patients in the Native American arm and 74 patients total.
Okay, so almost double.
Yeah.
And so all the patient has below knee, or it was SFA or higher?
We studied all infrainguinal lesions, so including SFA, as well as anterior tibial, peroneal, and posterior tibial arteries, and many patients also had disease in multiple territories, both above and below the knee.
Was there certain comorbidities higher in the Native American compared to the non-Native?
Very good question. So actually this is exactly what we found. Although the diabetes incidence was roughly the same, as well as the smoking incidence was roughly the same, both about 75%, you had a much higher incidence of chronic kidney disease in Native Americans, as well as a much higher incidence of patients being on dialysis. So about 33% of Native American patients were already on dialysis, compared to only 14% of the patients who were non-Native American.
So why is that? Do you think that speaks to the lack of health access to health, or?
I think the problem is quite complex. Clearly, access to health resources is somewhat lower in this vulnerable patient subpopulation. There may be also some genetic factors at play. And also clearly the incidence of chronic kidney disease was much higher compared to others, yes.
And then what was in terms of success? There's a procedure success, and what was in terms of
procedure success was actually quite good in both patient populations, and was comparable, was over 90% in both. And of course, that is only one measure of success if the procedure is successful, but the ultimate measure of success is freedom from amputation. So we studied that, and we had actually a very nice Kaplan-Meier curve to show that although these patients presented with higher incidence of comorbidities such as chronic kidney disease and dialysis, the freedom from amputation was roughly comparable in the two arms.
Interesting. Yeah.
So, although
basically,
not numerically exactly the same, there was no statistically significant difference between the two populations.
Right. So it sounds like as long as they have access to the lab or somebody who studied the lip perfusion,
yes,
these patients can do as well as anybody else.
Exactly, and that is, I think, a very encouraging message for us and for other practitioners in the field.
Right.
That even if the patients present late, even if they have a lot of comorbidities, even if the disease is very advanced, and we only studied the very advanced disease with severe calcifications, where you had to employ orbital atherectomy, even under those circumstances, not all is lost, and we can make a big difference in terms of these patients keeping their limbs on.
Absolutely. Any certain complication that happen higher in the native compared to non-native, like bleeding, transfusion, refer to vascular surgery?
We overall, we had a very low incidence of complications. The most common complication was perforation, but when that happened, generally that was wire perforation and did not lead to anything more severe, such as compartment syndrome, or there was no need to referral for vascular surgery, for example.
So how we can take this message to the audience and the interventionalists in the community?
The most important thing, both from a cardiovascular perspective and from patient education perspective, is it's very important to recognize the disease early, before it is too advanced, before there is extensive tissue loss, before the gangrene sets in, as early as you can detect it, and do an intervention and restore perfusion, revascularize these patients is very important. The better it is. The earlier it is, the better it is.
Absolutely. Thanks so much, Eugen, for presenting very interesting data at the CVI 2019. Please watch this video and others on CVI YouTube channel. This is Chadi Alraies from Denver, Colorado. Thank you.
Thank you very much, Chadi.
Thank you.